Now, every industry is going to have its own unique challenges when it comes to finance, but there's four in particular that we want to hone in on when it comes to healthcare. This will help you understand the why behind a lot of the processes that we'll cover in future slides, and it'll also give you some insight into some of management's top concerns when it comes to healthcare finance. First up, rising costs. Now, this one's not exactly unique to healthcare, but we'd still be remiss if we didn't mention it. You hear about rising costs and inflation all the time, and the healthcare industry certainly isn't immune to that phenomenon. When you think about all the big ticket costs that go into providing high quality healthcare, this one tends to hit the industry pretty hard. In order to keep up with the demands of patients and third parties, like insurers, for example, healthcare companies are expected to keep up with the Joneses, so to speak. There's a big expectation in making sure that state of the art equipment and procedures are being performed on patients, which, at least in theory, should lead to more efficient procedures, quicker recoveries, and overall, a better patient experience. Additionally, the quality care that companies are able to provide is really heavily dependent on the types of people that are in the organization. Whether it's the doctors, nurses, or admin staff, it takes a village to make sure that patients receive a great experience throughout the entire process. As you can probably imagine, hiring this level of talent can be expensive. So organizations need to make sure that they have budgets to cover those type of expenses. The next type of expenses go into making sure that companies are compliant with all the laws and regulations that are applicable to them. We covered a lot of these in length in a past course. Think back to laws and regulations like HIPAA, the Affordable Care Act, and the Stark Law. Making sure that a company is compliant with these laws and regulations can be a super expensive endeavor. At the end of the day, a lot of companies think about these efforts like an investment that allows them to serve their patients. While compliance with certain requirements is as simple as drawing up a quick policy, compliance with other requirements can be complicated, and in a lot of cases, they can require you to onboard new tools and new systems. So as an example of this, HIPAA requires companies to maintain a record, basically a log, of when PHI, protected health information data, is viewed by someone in the organization. Now, in order for a company to effectively meet that requirement, it might mean they need to procure a logging solution, pay some implementation fees to get that stood up, and then hire an analyst whose job is going to be to monitor and maintain the system. And that's just for one single requirement. So if you're an organization who needs to comply with multiple frameworks, all of which have different requirements, you can see how that cost quickly expands and grows. The third challenge is related to revenue pressure. And while pretty much any organization will be challenged to increase revenue, healthcare has a pretty unique situation when it comes to this regard. Many third payers, like Medicare and Medicaid, for example, have limitations on the amount that they're willing to reimburse healthcare providers for certain services. And it's not uncommon for those reimbursement rates to actually be lower than the true costs that it is for the healthcare provider. A lot of for-profit organizations that were in a similar situation might just simply refuse to provide those services. No sense in providing a good or service if it's just going to lower profit. But in the case of healthcare companies, especially the nonprofit companies, A, they're unable to reject services in the case of an emergency. If someone comes into the hospital and they're having a heart attack or some other serious condition, you can't just turn them away at the door because of an inability to pay. You still need to provide care regardless of their financial situation and make a best effort to fix whatever the issue is that they're running into. And B, even if the option existed to deny someone based on those circumstances, there's still a lot of reasons why healthcare organizations would still opt to provide the care. I would argue that the most important of those is that healthcare workers have an ethical obligation to provide care to individuals in need. So even if the business, the hospital, could deny care, it would conflict with the moral code of its workers. So this type of pressure really comes with the territory of being an organization in the healthcare space, and it's a situation that needs to be carefully navigated. And the last challenge we'll talk about here is just the overall variability when it comes to patients. There's no one size fits all model in healthcare. Pretty much all patients have different backgrounds, ailments, and other factors that impact the severity of an illness or an injury, and that impacts the care that they ultimately need to receive from the healthcare org. So it can be really difficult to estimate costs and revenues for that matter to project a company's finances. So again, organizations in the healthcare space need to account for variability when it comes to their operations and planning. And we'll talk about a few ways that companies can do that in the sections coming up. So now that we understand some of the most pressing financial challenges in healthcare, the next step is to ask what we can do to help solve or at least alleviate some of those challenges. And cost accounting is definitely one of the answers. Now, cost accounting ultimately gives management much greater insight into the financial story, if you will, of the business. It gives executives and senior managers the tools that they need to make decisions based off of strong historical data rather than just having an intuition or relying on what competitors are doing, for instance. So, the first thing or the first way that cost accounting helps is by identifying high cost procedures or any high cost services for that matter. These high cost procedures can be a huge financial risk for a company, especially if this company isn't able to regularly recover and absorb those costs. As a quick example, if there's a specific type of surgery that regularly gets performed, and we know that the surgery is going to cost the organization $15,000, but we're only able to charge or recover $10,000, we probably need to course correct and find a way to either cut costs or increase the amount of money that we're charging for that service or for that surgery in this case. Since there's limitations on our ability to charge more and make sure that we actually receive the money that we're charging for, cutting costs is usually the cleaner path forward. So we need to break down the process for performing the surgery into all the little tasks that get performed to make it possible. So purchasing our supplies, prepping the ER, making sure we've got all the right staff on site, all those seemingly little things that go into making the surgery happen are super important to break down at a more granular level. From there, we can figure out which of those we truly need to perform the procedure. And this allows us to become more efficient and start to trim some of those unnecessary costs. The second role of cost accounting is related to budgeting and financial planning. When we understand our historical costs at a more granular level, that allows us to better prepare for the future. We're able to better determine things like the amount and type of staff members that we'll need, amount of supplies that we'll require, and how much space we truly need to rent or otherwise acquire. We'll also have a lot better insight into the projected profitability for the year, assuming that we're also able to project revenues accurately in addition to the costs of a procedure or a service. The third bullet is around figuring out service line profitability. The bottom line is that some service lines will tend to be more profitable than others, and it's really important that as business managers, we have the ability to understand which service lines are helping us to truly sustain or grow our business. It's also possible, and likely in a lot of cases, that certain service lines only exist because they're effectively being supported or held up by higher profit service lines. If we take a large healthcare provider, for example, and look at the financial statements for that provider, we might see that our top two service lines account for 70% of the organization's overall profit, while three other service lines only account for 30% of it. Once we have understanding of certain data trends like that, it helps us and ultimately senior management make better decisions around where we need to be investing additional resources and where there might be opportunities to look for more efficiency in certain processes or procedures. The fourth point is that cost accounting can ultimately help us negotiate more favorable reimbursement rates when it comes to third-party payers like insurance companies. If we have data that shows the specific costs that go into providing a certain procedure or a service, we have a much stronger argument for requesting additional funds from the insurance companies or other third parties to actually help pay for and recover the costs of those services. If you're going to go to an insurance company or a third party like that and request higher reimbursement rates, the third parties are going to require evidence to justify the additional costs for them. Cost accounting is a really effective tool for us being able to justify those costs. Keep in mind, it's likely that you'll probably get some pushback here. We can't just assume that the third parties, like the insurance companies, are just going to accept our data at face value and automatically grant us additional fees. So we really need to be buttoned up here and make sure that our justification can be defended and properly documented. Lastly, cost accounting overall allows us to make better data-driven decisions. In the digital world that we live in today, we are absolutely surrounded by data. Over 400 million terabytes of data are created each day. What separates good companies from great companies is how they're able to transform that data into meaningful information, which in turn should turn into better business decisions. Cost accounting is just one of the mechanisms that helps an organization turn their raw data into that meaningful information. If we're able to then present that information to senior management in a form that they understand and appreciate, it'll lead to better decisions across the organization.